not everyone knows how to teach others. So like the ways in which we are teaching adults, teaching community members that needs to be taught to the teachers. Partnerships with other organizations and systems, yeah, that's definitely something that we are supporting here at P4HE as people who support cross-sector collaborations, sources that people don't see as bias. Yes, definitely safe platforms or groups to host these discussions. Yes, definitely accessible platforms. That isn't just social media. Yeah. Been thinking about that. Our news environment, which one of our panelists is a journalist, but our news environments are very warped, and there's lots of different sides there. Social media downloads with great visuals, data to include for the youth and elderly who are just learning tech. I think the generational part is definitely coming up. I'm a millennial, and Facebook was happening in college, but for young people, social media is their lives. So yeah, I think that that's very important. Training academics to use layman's speech. Yeah, we talk in academies. Thank you. Okay. Thank you all for sharing this. If you want to continue sharing, you can do so. You can also share in the chat, put questions in the chat, your thoughts in the chat. If you are using social media, TikTok, Instagram, Blue Sky, which I'm on, Twitter, some people are still on that, I'm not sure, but you can share your thoughts and comments about today's discussion on social media as well as in the chat. And with that, we will introduce our panel. So first, we have Bob Ortega, who is senior reporter and writer for CNN Investigations. Hi, Bob.
I had my audio turned off. Hello.
That's okay. Hi. Thanks for joining us. Um, we also have Dr. Reginald Tucker Seeley, who is principal and owner of Health Equity Strategy and Solutions. Hello, Dr. Tucker Seeley.
Hello.
Hi, thank you for joining us. So I'm excited about today's conversation because it's obvious that misinformation is a major part of all that is going on in our society right now, particularly related to health, which, is our area of interest. But I wanted to ask you, Bob, you're a journalist. Can you share about some of your experiences with health information, or excuse me, health misinformation?
Sure, I'd be happy to. And first of all, let me start by saying thank you very much for inviting me to be part of this. I'm really happy to be here and really be happy to be with Mr. Tucker Seeley and or all of you guys talking about this because I think it's just an incredibly important important area for discussion. And I also wanted to say, in addition to my work at CNN, I'm also on the board of the USC Center for Health Journalism, which is a group that has a different focus from you guys. Its focus is really working directly with news professionals, but on these very same kind of issues, advancing health equity and how to communicate with people effectively and how to how to ensure that we're countering misinformation and disinformation and talking with people in a way that's constructive. And so, in response to your question, I think, right now, scarily, when it comes to health and public funding for healthcare and the impacts of public policy, one of the biggest sources of disinformation and misinformation today is the federal government. We are seeing the government restrict the collection and sharing of data that can undercut the president's policy preferences. We're seeing wholesale attacks on against sources of truthful information, academics, universities, law firms, news media, foundations, anybody who is in a position to push back against some of the falsehoods that we're seeing. Ongoing campaigns against diversity, equity, and inclusion initiatives, and against the efficacy and safety of vaccines and other things. You were asking me about what I'm seeing. I mean, right now I'm talking to you from Idaho. This doesn't seemingly have anything to do with health. I was here helping cover for CNN this shooting incident that happened in which a young man who was 20 years old set a fire and then opened fire on firefighters who came to respond. But I bring this up because one of the things that immediately emerged on social media was a number of people saying, "Oh, the attackers," as soon as the attacker's identity became clear, and this is a young man who took his own life, and he's so in no position to counter or explain why he did what he did. But we saw on social media immediately a lot of people posting saying, "Oh, this guy's trans." And it's all these evil trans people that are doing all these terrible things. Well, it's nonsense. I mean, this is something that we've been looking at. Who is this guy and why did this happen? And there is absolutely zero evidence that that's the case. I think and so the attack against trans people is part of a broader attack against diversity, equity, and inclusion initiatives in general. It's an attack against medical care that helps people transition. In the last 24 hours, we've seen a lot of disinformation about the so-called Big Beautiful Bill, which, among other things, is going to eviscerate Medicaid and funding for a lot of VA medical care initiatives. And the fact that millions of people will lose access to that healthcare is being flatly misrepresented by many people in Congress and in the government. And so, I think to my mind, there's just a wide array of areas where this is really important. You know, the and more broadly, I think one other thing I just wanted to mention very quickly is that we are seeing this. One of the things that makes it also very challenging is that if you do a Google search, which is what a lot of people do, is their first thing to try to find out, like what's going on, if they have some particular health issue of their own, and they'll go to Dr. Google and put in a query, and Google is now directing people to its own problematic and often nonsensical AI, which is often provides people with highly questionable information when it comes to health issues. Facebook and X are steering readers away from the news sites and towards posts that often can make wildly inaccurate and politicized claims on a wide variety of topics. So I think that in my particular case, one of the things that I try to do in countering this is to do a lot of the strategies that you've just talked about in the beginning part of this seminar, which is trying to figure out ways to discuss information, focusing on being accurate, clear, effective. What is the source of information, and how do we know that it's trustworthy? How do you explain these things in a way that's really clear? That's the kind of stuff that I've been trying to focus on in my own work, and I think that all of us really need to look at. I don't know if that is addressing the question.
Yes, I think you said more than I was expecting. So I was trying to pick a thread to pull out of that, but I will say that I appreciate you being very straightforward and upfront about all of these um very contemporary and current issues that are related to misinformation. AI, if ChatGPT has no haters, I'm dead. Like I don't hate ChatGPT at all, but it's really a way of, perpetuating misinformation in a lot of ways.
I mean, you
Yeah.
have to be super careful because look, I mean, the problem with AI is that it's created and programmed by people who often infuse their own unconsciously infuse biases into it. And I will tell you, I'm just working right now on a story that has to do with use of force by federal government agencies, and I've gotten a slew of data that I've been going through, and we're trying to use AI in constructive ways at CNN, for example. And so I have this tens of thousands of pages of data that I've gotten through Freedom of Information Act requests. And I'm trying to figure out some way to go through it without having to read every single last line and every single page. I mean, this is like reading, 15 War and Pieces to get to, to get to the data. So I thought, oh, I'll try using an AI and see if it can search through this stuff and find information for me that's useful. And the first thing I discovered was that it was making stuff up, just flatly making up incidents that never happened, right? So it's then, you have to figure out ways to really, really tailor your questions to and then you have to go through and check, and make sure that it's not confabulating things.
Yeah.
Anyway, sorry, go ahead.
No, no, no.
I'll,
I'll get off on a tangent, a major tangent on AI. So I will stop there, but I will ask Dr. Tucker Seeley if there's anything that Bob spoke to that you want to speak about, because I have a specific
Yes.
question for you, but anything that you
Oh,
want to.
sure. Yeah, so I think one of the things, related to the things we've talked about so far is I feel like we don't in the health equity community recognize that there's a portion of our population here in this country that don't value equity. I think we come to this conversation assuming that everyone is, um, has the same goals or similar goals in terms of reducing or eliminating health inequities, and that may not necessarily be the case. I think the other issue is that a lack of a recognition around how we got here. I think many of us saw it coming, saw this space coming, but with fake news and alternative facts and sort of all of these kinds of phrases, um, and we sort of slid down that slippery slope really quickly to the place where we are now. And I agree with Bob that the bigger challenge, I think, for those of us in the health equity research community is that many of the much of the misinformation or disinformation is coming from the federal government and is coming from people that we are trying to sort of shape the public to trust that they may not necessarily be as trustworthy sort of in this space as we would like.
Well, yeah, I agree. Actually, that's the first thing that I wanted to, the first thread that I wanted to pull is the governmental perpetuation of misinformation. Um, what do we do? Like I said, or like you all have said, like everybody knows, we're in seemingly uncharted territory. But we know history repeats itself. So what do we do with governmental misinformation? I think somebody put in the chat RFK using AI. Yeah. Uh there's lots of instances of misinformation. What should we do in you all's opinion?
I mean, I think that's one of the areas where, just to cite the example of RFK and these, made up reports that he cited. Uh, One of the things that, if you looked at the New York Times, at CNN, at the Washington Post, at NPR, all of them essentially took the same tack in pointing out that, and in going to people who have great credibility to say, look, you know, he is providing Congress with information that is citing non-existent studies, that is citing studies that have been considered controversial for the following precise reasons, or studies that, or mischaracterizing studies in this particular fashion. So, I think if you can explain that very clearly and very succinctly, this is why this is nonsense. Um, and do so in a way where you're not saying, I mean, this is, I think, the big problem with social media, right? Is the temptation is to come back and fulminate, because these other people are fulminating in ways that are really nonsensical. And I think that takes you in the wrong direction, right? You just have to be, no, this is false. Let me explain why. Without saying, without tearing your hair out and screaming, this is bullshit. As tempting as that may be.
Yeah, indeed. And I think another challenge is really under explaining what is a credible source. I think we in academia are sort of, it's drilled into us, sort of through our graduate training, to always cite your source and to know sort of to know the source of what you're writing about. But the public doesn't necessarily do that. And I don't think we've done a really great job in terms of sort of differentiating, especially with the explosion of social media, sort of describing what a credible source is. And Bob, I think your point around being able to explain something clearly and succinctly is an important one, because I feel like we in academia, and as a former professor, I could just go on and talk for 20, 30 minutes, and the public doesn't have 20 or 30 minutes to listen to a point. And so being able to, sort of say something clearly and succinctly as a way to for the public to understand. But I think going back to my original point, that there is a sizable portion of this population that, regardless of the way that we describe it, regardless of the way that we, present our arguments clearly and succinctly, they are not going to care or not going to come around to wanting to support policies that focus on creating greater health equity in this country. And so I think that is a fine line that we have to walk in terms of, figuring out where people are on their health equity journey. Are they even on that journey? And if they aren't on that journey, then maybe, that's not necessarily the community that we're talking to in terms of trying to figure out ways in which we move health equity related policies forward.
I think that's really true, and I think one of the problems that you're kind of pointing out here is that there are a number of people who have been convinced that this is a zero-sum game, right? That
Indeed.
the only way that you can advance, the health of minority groups is by disadvantaging
Indeed.
the white majority,
Mhm.
and that's simply not true,
Right.
and so I should say I think that's the main point. It's simply not true, but I think it, it's it can be very hard to persuade people that that's not the case. And sometimes it comes down to even a one-on-one conversation to do that, and we don't always have time to do these one-on-one conversations, right? So,
Right.
I mean, the question there is how can we provide this information? And sometimes you're just going to have to rely on people eventually stepping up and looking for themselves,
Mhm.
in the right places.
Yeah, I think Heather McGee wrote a really great book and called that The Sum of Us, where that is, a central theme that, it isn't a zero sum game. If we help, the most marginalized in this country, that indeed helps to improve the health of all of us. But I think we struggle with this idea of thinking about sort of what is best for me versus what is best for my community, my population. That is this, those of us in public health sort of talk about sort of population health versus, the health of the entire population, whereas those in medicine are focusing on, the health of the individual. And I think sometimes we struggle with going, back and forth between, what is best for the individual versus what is best for the population. And I think we in academia could do a much better job of talking to the public about sort of what are the differences between sort of efforts that focus on the health of the individual versus efforts that focus on health of the population.
Yeah, and I think it goes back to the question too of kind of how you tell that story clearly, right?
Mhm.
I mean, for example, there was a news item today that was talking about. I don't know if any of you guys saw this already, but the Lancet had an article that was published yesterday that was talking about what the impact is going to be of the elimination of the foreign aid programs of the USAID, the Agency for International Development, right? And so I want to mention this just because I think it's a good example of this. So completely appropriately, the Lancet in its article, this is how it reads, and this is an article that's aimed at medical readers, people
Researchers,
who
right?
have a high degree of expertise. So, this is how their findings: higher levels of USAID funding, primarily directed towards LMICs, particularly African countries, were associated with a 15% reduction in age standardized all-cause mortality, risk ratio 0-85, 95% confidence index. And it goes on, to describe the findings, indicating that, that with a 95% confidence index, 91,839,633 all-age deaths were found. Anyway, it goes on like that, right? So, that's aimed at that audience. But what it really kind of comes down to, and this is how it's discussed, for example, on CNN in their article about this morning, is just to say that basically this means that this analysis means that the USAID funding cuts over the next 5 years could result in 14 million additional deaths, and that nearly a third of those deaths, more than 4.5 million, will be among children younger than 5. And then it goes on to say, here are the specific areas where that's likely to happen: higher rates of tuberculosis, higher rates of infant mortality from HIV, higher, et cetera. Just nailing down very specifically and very briefly who's going to be affected and how. And I think, a lot of it for us is to think about who are we trying to reach? And then how do we talk to those people in a way that helps them understand how this affects them?
Yeah, I think that's a really great point. One of the things I saw this video recently on YouTube, and it was explaining gravity to 5 different audiences, and it started with, how do you explain it to kindergartners? How do you explain it to middle schoolers? How do you explain it to a college graduate? How do you explain it to, an academic? And how would you explain it to a peer? And this was all done by like an astrophysics professor. And I think we don't recognize enough that the average reading level in this country is a 5th grade reading level.
Mm.
So we need to figure out, how do we tell the story that you just described, Bob, from the Lancet? How do we talk to our peers, which we do in journals like the Lancet, but how do we talk to everyday, how do we take that information and explain it at a 5th grade level so that people actually understand? And I don't think we in academia do. We pump out our academic papers to our peers, but we don't then take that information and figure out, then how do we communicate it to the various levels of understanding that are needed in this country so that people actually grasp the impact of the content of those articles.
Yeah,
And yeah, and I just saw the paywall comment come in there, that probably not everyone can access it. And as a former academic, I saw that, especially when I left my academic institution, that I could no longer access all of the journals that I had when I was a part of a university.
Yeah.
and I think, to answer that question, I mean, look, it can be a frustration, right? You look at the New York Times and you're like, well, why can't I read this for free? Well, I mean, there would be no New York Times, there would be no Washington Post, there would be no CNN for that matter, if we don't make money somehow to pay for the operations and to pay for the reporters and to pay for the work that we do. And so, if it's all free, then where's that money going to come from? So it has to come from somewhere. Some of it can come from advertising, and some of it unfortunately winds up coming from paywalls. But that's really no difference than asking, that's in a way that's no different from asking, why do I have to pay for a newspaper? Why do I have to pay for a book? If I go to a movie, why do I have to pay to go to the movie? How come I have to pay to go in there? I mean, sadly, I agree. Life-saving information should be free, and often news organizations will provide information for free when it's something that's really urgent, or it's a breaking story where it's absolutely vital to get this information out right now. But it's just that's unfortunately it's a reality that without paywalls of some sort, most traditional news organizations would not be able to continue their operations.
One thing that came up for me when you all were speaking is the use of different modes of communication. So, videos, I don't know about like CNN's videos, and social media, I would imagine is free, but also in the like organizing space, the use of zines and other forms of like infographics is also a way of communicating that can really break down information for the different audiences. Something that I was thinking about before is like, when we're dispelling misinformation, are we talking to individuals? Are we talking to regular people? Are we focusing on dispelling misinformation among politicians, for example? But I do want to ask a question that is in the chat, and this is on my list of questions. So someone posted in the chat about how emotions can change people's minds and people go where they're valued. And my official question, and we can start with Dr. Tucker Seeley, is something that has come up in our work on this topic in our previous listening sessions. Like I said, we recorded a podcast and it will be dropping soon. The episode will be dropping soon. But something that has come up is the psychosocial drivers of susceptibility to believing misinformation. And one of them that has stuck out, and I believe in your initial discussion that you had with us back in April, which I'm not sure, sorry about the timing, was the need for belonging, how people who believe misinformation, one of the core drivers is the need for belonging. And I was wondering if you could talk, both of you, talk about that, where you see that, and maybe even other psychosocial drivers.
Sure, yeah. And so I think that was either April or May that I was there to give a talk to your group. And I was citing a book called Wrong: How Media, Politics, and Identity Drive Our Appetite for Misinformation by Donegal Young. And she mentioned sort of three aspects of why individuals may be susceptible to misinformation. And one of them, is comprehension. We want to make sense of our world. We want to make sense of the things around us. The second thing is we want to have, some control over our world. And so, sort of being able to interpret, the information that comes in gives us a sense of control. And then the third thing is community. We want to be part of a social group. And if there are, things that our social group is believing in, our social group may have these kinds of, litmus tests around, whether or not we are really in the in group or not in the in group in terms of whether or not we believe something. And we saw this a lot during the pandemic in terms of masking and getting the vaccine. And so I think all of those things together sort of contribute to whether or not people are susceptible to information, and then how long they stay in that loop of accepting that information.
Yeah, and I mean, COVID was a particularly dramatic proof of that because we saw repeatedly people who literally were willing to die rather than rethink how what they believed. And it's kind of shocking to realize that that's the case, but it is the case. And I think then, the recognition that that sense of community and that sense of somehow that identifying in this particular way, makes me make sense of my world and makes me be part of a certain community, that does become a difficult thing to shake. And it's one of those things I think that really is you have to kind of address it um, systemically and repeatedly, one step at a time, in the sense that I think if you in some ways you can't hammer it in saying you're wrong, which goes back to because you can't make people's emotions wrong. They believe what they believe. But what you can do is sort of say, well, this is what we're seeing. What we're seeing is that if you wear a mask, just as like, what we're seeing is that if you wear a mask, this happens. If you don't, this happens. Or you just, you essentially what this comes down to, and I think also in a sense is storytelling, right?
Mm,
People tell themselves stories to make sense of the world.
mhm.
And what we can do sometimes is offer a different and hopefully more compelling story.
I agree with that 100%. I think we don't know enough of the narratives that are being told in communities to really understand what are the stories that are driving people to that level of misinformation. And we don't necessarily know, the we don't know the stories, the sort of at the sort of surface level, but then there's some concealed stories that may be underneath, that it might take a trusted sort of partner in that community to actually get the real story. So I'm sure, Bob, you've seen where, someone will tell you a story, but if it's not, someone that they trust, you really aren't going to get that concealed story about what's really going on.
Oh, 100%. I mean, I think I've told this story before. This goes back to Sunday, but some years ago when I was working along the border, uh, I realized that there were and I did some research into this and discovered that the rate of car use seat among Spanish-speaking immigrants in Arizona in particular was much lower than other people, and as a result, more kids were dying because they weren't properly restrained and they'd get in accidents and get killed. And so the challenge there was how do you reach people? Because the story was a baby is safest in its mother's arms.
Mm,
If you're sitting in a car and mom's holding the baby is safe. And so
mhm,
you had to essentially convince people that no, that is not the safe thing to do in a car.
mhm, mhm.
And, why are they going to believe me, a reporter? And
Right.
so one of the things that I wound up doing, because there was a real, these are folks, they're not all Catholic, but there's a predominant, they're predominantly Catholic. And so I actually went to the Archdiocese of Phoenix and talked to them about this issue. And I went to small evangelical churches that were Spanish speaking and that had, groups that they were very involved with. I went to some of the radio stations that work with that community radio stations and talked to these people about it, and basically enrolled them as partners in communicating to people why putting your kids in a car seat is safer than holding the kid in your arms. And with those partner groups, we were able to reach out to people that I would never, ever in a million years have been able to reach out to myself, because these are not people that at the time I was working at the Arizona Republic, English language newspaper, and most of these people would never have any reason to read that paper or to trust it or to know anything about it. So the only way to reach those people was through other organizations.
Yeah, it made me think of last year we had a webinar on anti-racism. And what we sort of came down to is that like our field of public health is just not set up to study and implement anti-racism. And it comes, it really comes from a different field, a different area. So like storytelling, we don't teach our students this is how you do storytelling. Like we don't do that. And then also broadening that to like systemic and consistent, I think, Bob, were the words that you use, approaches is something that we as the health equity community, which is I really like that phrase that we used in those questions. That's something that we have to expand ourselves. Expand our view of ourselves, as that's what we need to do. Someone in the chat also put about you all mentioned trustworthy communicators and put in the chat that they are in Baltimore, which I used to live in Baltimore. Yay. That, there are lots of instances of medical mistrust and harm perpetuated by public health as an institution. So acknowledging the past harms is key. So yeah, I just wanted to lift that up. And if you had any comments about like not just having trustworthy or trusted communicators, but
Yeah.
acknowledging past harms as well.
Yeah, I think that's an important point. I think one of the things that at the start during the pandemic, there was a conversation around, we need to have trust in our healthcare delivery system. And that conversation shifted, at least within the healthcare community, that the healthcare institutions need to be trustworthy partners in terms of, the community being able to trust them. And like you mentioned, Karen, the healthcare delivery system has a long history of, in healthcare research, has a long history of not being trustworthy partners, particularly to historically marginalized communities. And so, one, admitting those historical wrongs is an important step sort of in this process. Even if you weren't necessarily part of the institution when when those wrongs were committed, I think many leaders in the healthcare delivery sort of space really struggle with sort of admitting those past wrongs, especially if they were not part of the institutions when those wrongs were committed. But the community has a long memory. And sometimes it doesn't have to have a long memory. Sometimes it's contemporary issues of discrimination that people encounter as they are navigating it. And so I think sort of the recognition both of contemporary and historical wrongs is important in terms of being a trustworthy partner, but also, being able to do the thing you say you're going to do and to do it honestly and reliably, I think are also components of being a trustworthy partner.
Thank you. I wanted to build off of your story, Bob, and ask my next question. But really, it's about like how we can think about collaborating with other people who have more expertise, other people who are, as someone said in the chat, who are more trustworthy, either because of their same lived experience, they come from the same community, they're with different institutions that have trustworthiness or more trustworthiness than the one that you're working at. I've experienced that in multiple institutions, not just here. you know, when doing community engaged work, like that's just something that happens when you work for a university and you're trying to work in the community. You're like, no. So that I'm wondering about, like, how do you think about doing this work collaboratively to address or work against misinformation and disinformation?
Yeah, I mean, I think it's figuring out often it's figuring out who those interlocutors are, and how you can get engage with them, because those are the folks, like you say, it's really important, especially if you're talking about underserved communities, and especially depending on where you're coming from, and what your background is. I mean, maybe you have the same lived experience, maybe you don't, maybe you don't at all. Um, if you're talking about an immigrant community, especially maybe that's a different faith community or something where you just don't have have that shared background, then you need to find the folks who do, who can help you. I think who can help you do that. It's something that we've talked about a lot in journalism, especially local journalism, is really understanding the community and who the members are and how you interact with those people, so that you can communicate with them in a way that makes sense to them. Because culturally there may be all sorts of cultural differences, there may be all sorts of other differences. They may have historical reasons to mistrust either a health organization or an academic organization or a journalism organization. And I do agree, that owning up to those past mistakes is key. I know, that's something we've seen in news media. The Kansas City Star Times did a series a couple of years ago talking about how how historically it had misrepresented the Black community in Kansas City, and just, I mean, some really appalling coverage over decades. And they went back and analyzed these stories and how incredibly wrong they were and how awful they had been, as part of a promise to do better. Now, that's obviously, if you're going to make that promise, you got to live your word and really do it. But I think acknowledging that harm is the only way you can really kind of start that process. And I think that's just as true, like Dr. Tucker Seeley was saying, that's just as true for the medical community.
I wanted to ask uh, maybe the same question, but a little bit more bluntly. So, like, going back to something you said in the beginning, Bob, that the main sources, or some of the main sources of misinformation, are currently coming from the federal government, and thinking about the ways in which social media has been changed to perpetuate misinformation. I'm thinking of the algorithms on Twitter, the well, algorithms on YouTube and Instagram, like all of TikTok as well. How can we collaborate outside of the traditional, let me rephrase that, since we don't have the same credible partners, for example, how can we be creative, and maybe even building new communities to combat misinformation? How can we look to the future given our current context to combat misinformation? That was not a very succinct question, but I hope the sentiment came across.
Yeah, that's a really good question. I mean, I think, when you're talking about building community, I think that I think that really for a lot of I mean, and talking about the kind of health folks, that professionals that we're talking to presumably today, I think a lot of it has to do with going, the people that you're interacting with on a neighborhood level, right? In a way. So, you establish a sense of community because people know that you're out there and you're working with them and they can trust you. I think, that's kind of what it comes down to. There's this is kind of an odd example maybe, but if you think about Planned Parenthood, right, which gets characterized as purely abortion providers by people that are strongly anti-abortion. And the reality is that in a lot of communities where Planned Parenthood operates, they are also the primary source of a wide range of maternal care. They provide all sorts of other help to folks. And the people in those communities often know that the presentation of these guys is they just love to kill babies is not accurate or true. And so but that exists because they're out there in those communities and people have come to rely on them. And then of course that doesn't necessarily make a difference politically when you're talking about what's happening in a state capital or somewhere else that's miles away from where this is happening. But what aspect of that I think is relevant for the particular conversation we're having now is that the way you build community is by being out there and introducing yourselves to the community and getting engaged with the community. I don't know. That's the only answer I think I have on that.
I think too, it's something that, most of us in academia don't want to hear. It depends. It depends on the context. It depends on where you are. I think it's important that you develop relationships that aren't transactional, but with any relationship, it takes time to build. And so, being able to have, I mean, in certain instances, we don't necessarily have a lot of time, but, taking the time to build the relationships within the community and then funding for infrastructure building, because oftentimes we don't necessarily have the infrastructure within the communities to have these relationships, to then, develop programs, to implement those programs, to evaluate those programs that actually improve people's lives. And then recognizing that, health inequities did not happen overnight, and we aren't going to solve the problem overnight. So, the differences we see, and I work in the cancer space where, Black men have the worst outcomes across, most cancers. That wasn't created in, a couple of years. And so we aren't going to eliminate it in a couple of years. It's going to take time to sort of really understand, how these differences came about, and then addressing the modifiable factors along that pathway that created those differences.
Yeah, I mean, I think what you're saying is exactly true, and I also, just adding to it, one of the thoughts that somebody posted as you were saying that in the chat, which is that this is generational work. Sadly, and I mean, that is the case.
Mhm.
It's some of this stuff is going to take a long time to correct. I mean, look, we're still living with the legacy of the Civil War, and how long has it been?
Indeed, indeed, indeed.
Someone has asked about measuring misinformation. Any thoughts on that? And then I'll have like a final question for you all. But any thoughts on like how we measure misinformation?
Hmm. Um, I guess I'm not really sure exactly what you mean by measure. I mean, I think uh, I, I'm not sure how important. I mean, I don't know. Maybe, it's obvious. I guess it's good to know the extent of misinformation or how widespread it is or whatever it may be. So, I mean, to the extent that you do public opinion surveys, that can be, kind of helpful in understanding where people are at in their belief. If you're targeting a particular community, maybe that's one way of understanding what they believe on the particular issues that you're interested in. I mean, I will say, on a national level, CNN does polling all the time, several times a week. We have polls coming out, and frankly, the what you discover from reading those polls is that Americans are woefully misinformed on an incredibly wide variety of subjects and believe all sorts of nonsensical things. And I mean, I'm oversimplifying, obviously, but it's unfortunately it is generally the case that people have very strongly held opinions that are often based on completely inaccurate perceptions. And so I think knowing that does help you realize maybe where your starting point is.
Okay, okay. Okay, I will then ask you, both, what, if you could just in a few words, articulate what you think the next steps should be to address misinformation.
Well, so I would say, you know, from the perspective of the folks that are taking part in this seminar, right? If you're talking about the misinformation, I think the question that you might be thinking about there is, um, who, you know, what is the specific, like, you know, I mean, get down to specifics, right? What, who am I reaching out to? Who am I trying to communicate with? On a particular subject, topic, area, you know, thing that I'm working on, whatever it may be. Who am I trying to communicate, and what are the types of misinformation that they are, you know, that I need to address in order to be able to what do I need to counter? And so this, you know, trying to kind of analyze that as specifically as you can in terms of who you need to reach out to, what it is that they're believing, why perhaps they're believing that, and then that will give you the basis for coming at that in a way that could be productive. You know, and I'll just say very briefly, like, you know, there are a lot of people who, when I meet them and I say, "Hi, I'm a reporter for CNN," they're like, "Oh, you guys just lie about everything all the time." And then, you know, my choice is I can walk away or I can say, "Oh, like what, for example? What do you think we lie about?" And then, you know, you can actually have a conversation. Now, that conversation may or may not lead anywhere, but the only way to get it to start it is by getting into the specifics. You know, I'll defer to
Yeah.
Reggie now.
Yeah, I agree wholeheartedly. I think it's important that we meet people where they are, sort of understanding sort of where they are in terms of, you know, whatever narrative is that they have about your topic, and then understanding the stories that they are telling about that particular topic, because then that'll help us as health in the health equity community to craft counter narratives around sort of their narrative that may be based on misinformation. I think the challenge may be, though, is that sometimes we expect the health equity sort of research to be further along that than it is in terms of us being able to craft that counter story. Because if we haven't, over the many decades of health funding, if we haven't had the research funding to do the studies, to get the evidence-based practices, to have the counter narrative, then it's going to be challenging to counter some of those stories if we don't necessarily have, you know, the evidence-based practice to adequately counter it.
Thank you, Reggie, for explaining that much more clearly.
Oh no.
No, I mean, I really, I'm genuinely, I think that was a really, really good explanation. Thank you.
Oh, thank you. Thank you.
I think it highlights our need for everyone to be involved. Our cross-sector collaborative, that's our goal. And so I really want to thank you both for your work, and which your work is in the chat. We highlighted the links to your work in the chat, but also just for being with us today. So yeah, thank you so much. And we want to just end it here with a few announcements. But again, thank you. We
Thanks for
want,
the invitation.
thanks, of course. You both are, you know, contributing a lot. So yeah, thank you so much. We want to learn from you all, our audience, how practical and applicable to your work the conversations we've had today are. I think they're pretty practical, pretty applicable. So again, thanking our panel, we'd like to invite you, our attendees, to fill out a short survey. The link is being dropped in the chat now, or you can access it by scanning the QR code that you're seeing on your screen. So yeah, everyone, please let us know if you know you like this content. I hope you did. It's really making me think about the role of storytelling and expanding how public health people or health equity people think about the work that they're doing, particularly here to address misinformation. So with that, we are concluding our session today and invite you to join us for our upcoming interactive learning session, which will be on July 30th from 1 to 2 p.m. Central Standard Time. You can again scan the QR code on your screen for that. For the latest information on the P4HE Collaborative, including all upcoming events, as well as the podcast that I was told was dropped today on misinformation, new health equity resources, please visit our website and sign up for our newsletter. Connect with us on social media to access shareable health equity content and engage with topics relevant to you and your work. We look forward to collaborating with you soon. Have a great day, everyone.